As Fourfront Contributor, we represent 4 of Washington's largest community behavioral health providers. Together, we know firsthand the positive impact a transition to the CCBHC model would have for our most vulnerable community members statewide. CCBHC is a nationally proven model for funding high-quality community behavioral health to ensure low-income individuals can access mental health and substance use treatment. The model supports workforce retention, expanded care delivery, and robust outcome reporting. Soon, Washington will have an opportunity to modernize funding for our community behavioral health system by transitioning to a CCBHC model statewide, following incredible success seen in other states. For example, Nevada reported a 250% increase in clients served, and Oklahoma state officials saw a 700% increase in medication-assisted treatment for people at risk of overdose. There are multiple reasons why the transition to CCBHC is necessary to address historic workforce shortages and declining access to care. First, and most critically, there simply aren't enough behavioral health providers to meet demand. To illustrate the impact of this catastrophic issue, thousands of clients are currently going without care, resulting in increases in those requiring crisis services and more expensive care, and destabilizing the health of our overall communities as more people go without mental health services when they need it most. Right now, based on clinician vacancies at our 4 agencies alone, more than 12,000 individuals are not getting the care they need in any given month. And that number is much larger statewide. Some programs have been forced to stop accepting new clients so a limited staff can focus on existing individuals and families in need. Other programs have closed entirely. The CCBHC model enables community behavioral health agencies to offer competitive compensation to better recruit and retain additional staff members, as well as fund the training and technologies that help ensure access and equity in services. On average, CCBHCs have hired 41 new staff members per clinic. Comprehensive Healthcare, which was a demonstration site under a 2-year federal grant, hired 20 new staff, with more expected under the full CCBHC model. Put simply, the CCBHC model presents an opportunity to improve how we do business and how people are cared for. Behavioral health agencies in Washington operate within a statewide system that is funded primarily based on the volume of encounters. This system does not compensate providers for the total cost of care provided to clients and communities. This has led to the chronic underfunding of the system and provider agencies, making it exponentially more difficult to offer competitive compensation or recruit and retain the staff necessary to provide successful services. The key goal of changing the funding model is to allow us to serve anyone who needs care, regardless of their ability to pay. Data shows that CCBHCs also reduce burdens on hospitals, jails, schools, and other community partners. For example, when Oklahoma adopted the CCBHC model statewide, the number of behavioral health clients seen in emergency departments dropped by as much as 47%, with similar results mirrored in other states. And finally, perhaps the best reason of all, CCBHCs just plain work. CCBHCs make it possible to receive the right care at the right time. From crisis response to outpatient therapy and other preventative services, CCBHCs are the solution that Washington needs. To learn more, visit our website at fourfrontcontributor.org.